Hi, my name is Siddharth Srivastava. I'm a child neurologist and neurodevelopmental disability specialist at Boston Children's Hospital, where I direct our Phelan-McDermid syndrome clinic and run a number of different research studies focused on PMS. One of our studies is a long-running natural history study of PMS through our Developmental Synaptopathies Consortium. Dr. Mustafa Sahin leads the entire consortium, and Dr. Alex Kolevzon runs the PMS portion. In honor of Epilepsy Awareness Month, I wanted to talk about some of our data from this study. Last year, we published a paper exploring seizures in PMS, including their prevalence, types, genetic correlates, and links to cognitive and adaptive functioning. We analyzed data from 98 participants with PMS who were enrolled in the Developmental Synaptopathies Consortium. This is work led by Tess Levy, and here's what we found. In terms of prevalence, about 42% of the entire cohort reported a history of seizures, about 27% had generalized seizures, about 20% had focal seizures, and about 13% had an unclassified seizure type. The average age of onset for generalized seizures was about 8 years. For focal seizures, it was about 10 years. And in general, the age of onset was fairly variable. When we looked at correlations between seizures and cognitive functioning, we found that individuals with the history of seizures had lower self-help skills and lower IQ scores compared to those without seizures. And this was particularly true for those with generalized seizures. We also looked at genotype-phenotype correlations. There is not a statistically significant relationship in terms of seizure prevalence versus genetic grouping, be it class 1 deletion versus class 2 deletion versus sequence variants. However, among individuals who had larger chromosomal deletions, those with seizures tended to have a larger number of genes within that deleted segment compared to those without seizures. And we did find that developmental regression was more common in those who had generalized seizures versus those without. In those individuals who did have seizures, they'd use various medications to treat their seizures. The three most commonly used anti-seizure drugs included levetiracetam, valproic, and lamotrigine. Overall, these results highlight correlates of seizures in individuals with Phelan-McDermid syndrome. I think we need to definitely continue to study this very important aspect of the presentation of Phelan-McDermid syndrome. Thank you so much.